Northwestern Health Unit acknowledges that we are on the treaty lands and traditional territory of the Anishinaabe and Métis Nations. We pay tribute to their legacy and the legacy of all Indigenous peoples of Canada, whose enduring presence is felt to this day. Northwestern Health Unit is committed to the principles of reconciliation and the calls to action outlined by the Truth and Reconciliation Commission of Canada. I will be starting off this webinar with a short introduction to outline why Northwestern Health Unit commissioned a Supervised Consumption Services report, where Supervised Consumption Services is situated in the bigger picture, and how we plan to move forward. In 2021, we were very concerned with the increase in opioid overdoses provincially and locally when reviewing the 2020 statistics. We made the decision to move ahead with the reports to explore the usefulness of supervised consumption services in Northwestern Health Unit. At the time, we were receiving information locally of an increasing number of overdoses being experienced by clients and deaths being reported, although we did not have official statistics. Unfortunately, overdose deaths in the Northwestern Health Unit catchment area has rapidly increased. The increase between 2019 and 2020 was 89%, and in 2021, it was increased by 88% again. In addition, in 2021, the Northwestern Health Unit rate was more than twice as high as the provincial rate. Hospitalization data shows that generally Northwestern Health Unit has higher rates than Ontario. There was some improvement in 2018 to 2020, but an increase in 2021 to above provincial rates. Emergency room visits for opioid overdoses increased, with the rate more than quadrupling from 2016 to 2021. In 2020 and 2021, the rate in Northwestern Health Unit increased well beyond the provincial rate, with a Northwestern Health Unit rate 53% higher than that of the province. The work of public health units is instructed and guided by the Ontario Public Health Standards. There are 4 foundational standards and 9 program standards. Under each standard, there are many program outcomes and requirements. Specifically related to supervised consumption services, I'm highlighting 2 program outcomes in this slide. One from the foundational standard and a similar one specific to substance use and injury prevention. The Board of Health is aware of and uses data to influence and inform the development of local healthy public policy and its programs and services for preventing injuries, preventing substance use, and reducing harms associated with substance use. Public health units follow 4 principles in making decisions. Is there an established need for a program? Will the program have a positive impact on health? And will the program address the need or the problem? Is there capacity in the system to implement the program? And what partnerships and collaboration are best suited for a program? There are 4 pillars to a public health approach to address substance use. Northwestern Health Unit works with all of these pillars, but primarily in prevention, harm reduction, and enforcement. Preventing substance misuse starts as early as the prenatal period and involves enhancing early childhood development, which we target through our family health and Healthy Babies and Healthy Children programming. It continues into the school years and early adulthood through our school programming and our work with our municipalities and social service partners. Similar to other health units, Northwestern Health Unit has a relatively smaller role in treatment, and our work in this area is related to smoking cessation. All health units have a harm reduction program, and ours includes the needle distribution program, the naloxone program, and outreach program. Northwestern Health Unit also enforces legislation in the Smoke-Free Ontario Act, which focuses on preventing smoking in restricted locations. Example, indoors in some public institutions such as schools and hospitals. And we also enforce legislation on the labeling, signage, and sale of cigarettes, vaping products, and cannabis to minors. Addiction is a complex and multifactorial problem. There's no magic bullet that is going to solve the problem and make all the associated negative impacts go away. This slide shows all the possible factors that can increase the risk of substance use, substance misuse, which may then lead on to substance use disorder. As you can see, there are numerous factors at birth, early childhood, within the family and school setting, and in the larger community. Many of these factors are socially determined. Many individuals can be impacted by multiple factors at different points in their lives, and these factors can impact a person's overall physical and mental health. A diagnosable substance use disorder is a complex chronic medical illness that changes how the brain functions. Like many chronic medical illnesses, the management is not the same for everyone, and for some, a direct pathway to a treatment and cure may be slow. The complexity of substance use disorders highlights the importance of harm reduction services. Harm reduction services sits between prevention and treatment. The services are there to help those where prevention failed and where a person is not able or capable of treatment. In principle, harm reduction is meant to reduce the harms of substance misuse. It is compassionate and non-judgmental and meets a person where they are at. Services are pragmatic and recognizes the benefits of reducing harm to the individual and the community, although clients continue to use a substance. There are a number of benefits from supervised consumption services as outlined by Health Canada. They reduce the risk of accidental overdose because people are not rushing or using alone. They connect people to social services and healthcare services. They increase access and engagement with treatment. They reduce public drug use and discarded drug equipment. They reduce the spread of infectious diseases such as HIV. And they reduce the strain on emergency medical services so they can focus on other emergencies. They provide space for people to connect with staff and peers, which can help a person moderate their drug use and decide to pursue treatment. In addition, reviews of research studies looking for potential negative impacts have shown that it does not increase the initiation of drug use. It does not discourage accessing treatment, and services do not increase crime in its vicinity. There's still a significant amount of work ahead to move forward with the recommendations of the report. Taking action on the recommendations requires a multi-sector approach, and the next step will be to discuss this report at appropriate tables or committees in the 4 communities. Northwestern Health Unit will continue to communicate the impacts of substance use, injection drug use, and opioid overdoses to partner agencies and the public by releasing regular opioid overdose reports and reports on relevant infectious diseases and mental health. We will also continue to provide evidence-based information on supervised consumption services to patrons and the general public, and remain committed to working with local partners and stakeholders to move the recommendations forward. Thank you. I'll now pass it back to you, John.
All right, thank you so much for that presentation. And at this point, we would like to kick off the second half of our presentation today with Steve Lowe, founder and managing director of LBCG Consulting for Impact. Steve?
Thank you, John. And I'll just do a little introduction to the report, and good afternoon, everyone. First of all, John described the purpose of the project, and that was what drove our work throughout the initiative. We were really pleased to collaborate with the Ontario Public Health Association on the project. We've worked with them on a number of initiatives and really have benefited from their expertise. I won't repeat the purpose statement, but talk a little bit more about the scope. We were asked to report on the need and the potential benefits of supervised consumption services and the perspectives of local stakeholders, specifically through an analysis of regional substance use mortality and morbidity data, as Dr. Young-Hoon was reviewing in the earlier slides, gathering the perspectives of all the community stakeholders, and guidance from harm reduction key informants and literature, since there has been experience in other areas in supervised consumption services. It's important to note that this report is not an application for supervised consumption services, nor is it an implementation plan. Those are recommended next steps in the report to be taken by interested local stakeholders. What was driving us in the report, again touched on by the medical officer of health, was really the burden of the drug crisis in the region. And so there's a lot of information in the report that my colleagues are going to go over that will talk about that, and will also emphasize, as the medical officer of health did, that it's part of the mandate of the health unit and the Ontario Public Health Standards to address population health assessment, substance use, and injury prevention. So the health unit, in commissioning this study and this report, was looking for solutions to reduce substance use related injuries, hospitalizations, and deaths, the risk of infections from sharing and reusing drug use equipment, reducing public drug use and improperly discarded needles in the communities, and increasing access to healthcare treatment and supportive services for people who use drugs. And it was these drivers and this scope that really drove the study and the report. And now I'll pass it over to my colleague, John Atkinson, to talk a little bit more about the report. John?
Sorry, I'm just having a glitch here. Can you hear me?
Yes, we can hear you.
Okay, great. So thanks very much, Steve. I'm pleased to be here on behalf of the Ontario Public Health Association and LBCG. So supervised consumption services, or SCS, as we've been referring to them, are legally operated facilities where people can come to use their own drugs under the supervision of health workers or professionals. There are many supervised consumption services being implemented in Canadian communities and numerous other communities abroad. As previously mentioned, supervised consumption services and looking at these was the focus of the needs assessment. We didn't do an in-depth assessment of the research on supervised consumption services or other harm reduction measures. Rather, we built upon the understanding that SCS are an effective means to reduce the harms of related to drug use. And we drew upon Health Canada's Canadian Drugs and Substances Strategy, as Dr. Young-Hoon referenced, and its guidance and evidence base, which supervised consumption services are a recommended element. On the next slide, you'll see that we're going to talk about today how Northwestern Ontario has some of the highest rates of substance-related harms. So while the communities of Sioux Lookout, Dryden, Fort Frances, and Kenora are smaller than those that typically have supervised consumption services, there are still a substantial population of people who use drugs living in these communities. SCS have been shown to be beneficial for communities by reducing harms of drug use, including overdoses, interpersonal conflict and harm, discarded drug equipment, and reducing infections and communicable disease spread. They also can provide support for women who are disproportionately at risk for gender-based power relations and violence. Supervised consumption services reduce harms by providing clean and safe spaces, drug use equipment, and peer support, all while connecting them with other health and social supports. On the next slide, we wanted to highlight that the research shows that supervised consumption services are indeed helpful in reducing harms such as opioid overdose, morbidity and mortality, while improving access to addiction treatment services. Research also found that the implementation of SCS was not associated with increases or decreases in crime or public nuisance. I'd now like to pass it over to my colleague, Melanie Sanderson.
Thanks, John. So when we looked at data from Public Health Ontario's interactive opioid tool, we found that substance use and related harms have been increasing And I think this is something that was also reflected in Dr. Kit Young-Hoon's comments a moment ago. So I won't really spend too much time on these next two slides. But as an example, we did find when looking at the provincial rates of opioid-related emergency department visits per 100,000 that there was an increase. For example, from 2020 to 2021, the rate had increased by 34.8%. We also wanted to mention that the COVID-19 pandemic has impacted trends. A report that we referenced by Gomez et al. States that in Ontario during the year 2020, there were 60% more confirmed or suspected opioid-related deaths than in 2019. Some of the factors about COVID-19 that may have contributed to this could be things like more isolation, using drugs alone, stress and anxiety, changes in access to services, as well as increasingly unpredictable drug supplies. So looking at the opioid-related indicators for morbidity and mortality, more specific to the Northwestern Health Unit region, it echoes, again, comments that Dr. Kit Young-Hoon was mentioning earlier in that the year 2021 opioid-related emergency room visits, hospitalizations, and deaths saw increases. And for all three indicators, those in the Northwestern Health Unit region were higher than the rates for Ontario. So for example, Dr. Young-Hoon already mentioned about the opioid-related emergency department visit rates being above provincial rates. And in 2021, we can also see when looking at the opioid-related hospitalizations per 100,000 that this rate was 42% higher in the health unit catchment area than in Ontario overall. And opioid-related deaths per 100,000 were 97% higher in the Northwestern Health Unit region when also compared to the rates in Ontario. And while we are seeing the contrast in these rates around some of the harms that we looked at, one of our limitations is that it was not part of our work to do statistical analysis on the differences in rates or changes over time. If we move on to, yes, on this slide, so again, still looking at that data from Public Health Ontario's interactive opioid data tool. This is a 6-year period that is showing how opioid-related morbidity and mortality rates have changed. And I believe this is referencing, again, back to that same data that Dr. Kit Young-Hoon was showing earlier on one of her slides, but she was showing that data from 2005 to 2021, and this is a bit of a close-up on a shorter time span in recent years. When we look on the next slide, we can see data from ambulatory visits that we looked at that was extracted in May of 2022. We found that rates for substance-related reasons for emergency department visits, and that included both drugs and alcohol, were much higher than the Ontario-wide rates. And these differences between rates were in the ranges of being from 443% to 506% higher. Looking at indicators around bloodborne diseases that were pulled from IFIS in May 2022, we found that incidence rates for hepatitis C for the Northwestern Health Unit catchment area were higher than the provincial averages. The 10-year averages for HIV incidence rates across the Northwestern Health Unit region were lower than the provincial rate. However, GAS incidence rates per 100,000 from 2016 to 2021 were 588% higher than the provincial average. Next, I'll turn it over to Nick to talk a little bit about the report methodology.
Thank you, Melanie. So before we get into the recommendations of the report, I will speak briefly to the project's methodology and its overall progression. So at this point, I am the fourth of our 4 team members present today presenting, but we were also supported by 3 subject matter experts in the field of harm reduction. Their contributions helped complement our project team so that it was a collection of various backgrounds to ensure that we had a diversity of skills and experience to complete the work. So for a quick overview of the timeline of the needs assessment, the project was initiated back in May, then ramping up to the stakeholder engagement in July and August, and finally delving into the analysis and the report drafts in the last quarter of 2022. Some final actions did see the timeline extended out further into 2023 than originally planned, but we are really pleased to be here at the finished product. So just to unpack what was included in the stakeholder engagement in a bit more detail, there was 3 main engagement tools that we used: the in-person survey with people who use drugs, online public survey, and multiple facilitated discussions through interviews and focus groups that some of you may have participated in yourself. We were very pleased to have the engagement in each of these streams exceed initial targets and ultimately reaching almost a combined 2,000 individuals for the whole project. So just to spend a bit more time explaining some details about the 2 surveys. The first, the people who use drug survey, was really critical, as if supervised consumption services are to be successful in the area, they really need to be accepted and used by local clients by catering to their specific needs. The survey was designed and implemented under the direction of our harm reduction researchers to investigate and probe and get some information around this area. The sample targets for each survey site were reached, getting a good distribution of participants from all 4 communities that we were looking at. And while we'll not be going into details of the results today, there is a wealth of information gathered, all captured within the body of the report. Likewise, it is important that this initiative was open to the broader public for participation. We were pleased to see participation across the region, with individuals expressing their views, receiving responses both that were for and against supervised consumption services. As you'll see in the pie graph to the right, we did see greater uptake from Kenora. However, we were able to separate the community-specific results for this survey, but all the data that we also collected throughout the entire project, so the outcomes of one community would not dominate over the others. So within the report, there is a considerable section dedicated to communicating the findings of the needs assessment that we encourage everyone to find a chance to review. We will be highlighting a few of these items in relation to the report's specific recommendations, but given that we don't have all the time to cover them in the findings today of our presentation, we'll now be moving into the recommendations. So I'll pass it back to Melanie, who will speak to the first recommendation.
Thanks, Nick. So the first recommendation makes the point that for each of the 4 communities, the rates of substance use harms are significant enough to indicate a need for greater harm reduction and treatment services. And with regards to the addition of supervised consumption services, this would be a means recommended to help reduce the risks of harm, overdoses, and overdose deaths among persons who use drugs. This recommendation takes into account the data that did demonstrate a disproportional burden of harm within each of the communities when comparing how the indicators exceeded provincial rates. And it also takes into account looking at how the rates of harm in this case do show a clear need for additional strategies and resources. We also heard through the engagement efforts that there is interest from people who use drugs around using supervised consumption services. And we also heard from service providers that there is a motivation to implement something to this regard. We also wanted to make the note that not everyone we heard from demonstrated support for supervised consumption services. However, our findings do suggest that there is a majority who are in favor. So moving on to the next slide, as I mentioned, that we are seeing those higher rates of harms in each of the 4 communities. And this table just breaks it down a little bit more by community in simplified terms to show how each of the indicators we looked at compare when we look at the community level, which in this case was at the level of the local health hub versus the data for the Northwestern Health Unit catchment area, as well as the province. On the next slide, here we're just showing the level of support that we saw through the survey engagements. And while there is a larger majority indicating support among people who use drugs, you can also see in terms of the online public survey results where the strongly agree option was the largest portion of responses at 38%. So next, I'll pass it over to John, who's going to talk a little bit about recommendation number 2.
Thank you, Melanie. The second recommendation points to how health, social, and/or mental health service providers are best positioned to lead the development planning of supervised consumption services. These providers include Indigenous providers, as they have the most knowledge and expertise in harm reduction, and can and should be the ones to engage with people who use drugs to ensure that SCS meet their needs. The recommendation also points to the need to determine a model or approach to supervised consumption services and how they will integrate into the service provider landscape in order to meet the needs of those in town, those who are in more rural areas, and those who are from Indigenous communities. In order to create supervised consumption services, knowing what resources, including funding, will need to be determined for each community. Securing funding and applying to Health Canada for an exemption are all required. We have provided some suggestions of potential funding sources. Some of these are examples of how other SCS providers have funded their work. On the next slide, I'll highlight some considerations when introducing SCS. While supervised consumption services can be beneficial in reducing harms, as we've stated, they're not a solution that will solve all drug-related issues in Northwestern Ontario. It's therefore important that SCS are included to be a part of an overall harm reduction framework, which we'll speak about in a moment. Harm reduction is an approach that aims to reduce the health and social harms of substance use and addiction. It's intended to meet people who use drugs where they are and provide them with choices of how they'll minimize harms through non-judgmental and non-coercive strategies in order to enhance skills and knowledge to live safer and healthier lives. While treatment services are important and often aim to help individuals become sober, individuals coping with addiction and problematic substance use may not be in a position to remain abstinent from the substance that they use. Therefore, supervised consumption services can reduce harms to those who use drugs where treatment is not feasible. On the next slide, I'll talk about different considerations in the design of supervised consumption services. SCS have also been called overdose prevention sites, supervised or safe injection sites, or safe consumption sites. The term SCS is more commonly being used as non-injectable drugs that are snorted, swallowed, or smoked can now be included as part of these services. Designing SCS for each of Kenora, Dryden, Sioux Lookout, and Fort Frances should consider whether one or more of these models are best to meet the needs of the population of people who use drugs in these communities. There are four main models, including standalone facilities, ones that are included in an existing facility that has other support services, and ones that are embedded within other service settings like hospitals or shelters, among others, and ones where mobile services are provided to reach people who are more spread out. I'll now pass it back to Nick to continue.
Thanks, John. So while John was speaking to in the last recommendation that it was identify that health, social, and mental health service providers may be best positioned to lead the development planning of any supervised consumption services that are pursued, recommendation 3 speaks to how any of these plans need to be developed while continuing to engage with the greater scope of key stakeholders, such as local governments, emergency services, Indigenous partners, and the broader community. This includes proactively engaging them to identify risks and collaborate on mitigation strategies that address them. We feel it is fair to say that there are still many individuals that do not fully understand what supervised consumption services are and the benefits that they can bring. And this limited awareness can contribute to or perpetuate fears about them. Given this, it is really important to be able to lead the discussion, educating in order to address fears, correct misinformation, and to moderate expectations of what impacts of supervised consumption services can have. Here I've pulled a sampling of some important points that were raised during the stakeholder engagement. As I had mentioned, there is a wealth of insights regarding the current challenges and potential solutions needed regarding drug use in the region, And I urge everybody to find the time to look in the body of the report, to have an opportunity to see them all if you have not had a chance already. So what I was able to fit in one slide was these points. That people who use drugs do not have safe or non-judgmental spaces to use drugs, and supervised consumption services can address this. So in addition to harm reduction, part of these services is creating spaces for dignity. Additionally, while services for people who use drugs exist in all communities, and some more than others, it was acknowledged that there are not enough services effectively leaving gaps. People we spoke to recognized that the problem with drug-related harms are significant in their communities, and really all possible tools need to be considered and potentially used. That there were concerns and tensions in communities, including public drug use and discarded needles being left in numerous places, in addition to other factors. That there is still space for understanding and general knowledge about supervised consumption services and their benefits. So, proactive education continues to be important to raise awareness and build support. This was something that we heard frequently as we've been mentioning it. And at the same time, engaging and building trust with people who use drugs is also critical, or else you risk the services not being used at all. Individuals knowledgeable about implementing supervised consumption services were frank that securing funds for these services is a common challenge that should be anticipated when approaching this. And lastly, while also having dialogue about the benefits of supervised consumption services, it is also very important to balance it with open dialogue about the risks and the stakeholder concerns that are equally important, so that you can have transparency and productive discord. These need to be heard, understood, and responded to where possible. So ultimately, it is important that expectations of all stakeholders must be managed so that metrics of success are realistic and grounded. Recommendation 4 emphasizes that any supervised consumption services need to not be siloed from other relevant services and strategies. This is where we're talking about it being within a greater harm reduction strategy or framework. Just as with the Canadian Drug and Substances Strategy, supervised consumption services are just one additional piece of a larger effort and plan. Any parties moving forward with exploring the development of supervised consumption services need to take into account of what is already existing in their community and the local situation and needs. At the same time, any initiatives in the region being developed in parallel, so Dryden, Kenora, Fort Francis, or Sioux Lookout, should really keep communications channels open, sharing and learning from each other. To assist each community that chooses to explore further the development of supervised consumption service plans, our report was broken down into community-specific sections. There is a section preceding the community-specific sections that shares findings that apply across the entire region, so common findings that should also be taken into account for any future related work, in addition to what is specifically highlighted in each community subsection. And so with that, I will pass it back to Melanie for the final 2 recommendations.
Thanks, Nick. So in this 5th recommendation, we highlight the need for developing and implementing educational activities that would be geared towards the public and partners. These educational activities would have a few different layers. So for example, raising awareness among and working alongside community leaders will be important to be able to understand what concerns the communities have. And also by understanding these concerns and addressing them, it can help to help the initiative to succeed and be sustainable. The other piece of it is that these educational activities can be leveraged to go beyond fostering buy-in and support by really helping to align to that 3rd recommendation that Nick was talking about around engaging key stakeholders in the development and implementation of the supervised consumption services. And then lastly, another layer of those educational activities that this recommendation speaks to is the need to support the general public so that they have access to accurate information and evidence surrounding supervised consumption services that can really help to answer their questions, equip them against any misconceptions, and also foster an understanding and empathy around addiction so that where there is stigma, it can be broken down as well. Moving into the sixth recommendation. So on the next slide, here we think that it would be important to develop an evaluation plan that can be applied if any supervised consumption services are implemented. So in this recommendation, we are making the recommendation that the evaluation plan look to assess client uptake and community impact according to the goals that the community is setting around their harm reduction strategy. And that these activities also serve to communicate those key impacts as well as where progress is being gained. And at the same time, the evaluation can help to flag any areas warranting adjustments or further improvements along the way. And with that, that was the last recommendation. So I'm going to pass it back to Steve now for a few concluding words.
Thanks very much, Melanie and John and Nick. I hope this has provided an overview of the report for you. As my colleagues have mentioned, the report is quite large and has a lot of data. And so in the interest of time, we've just covered some of the key points here, including, of course, most importantly, the recommendations.